Hi Jonas. I'm going to go through intramuscular or IM injection procedure with you now. We'll look at the areas of the body where injections can be given. Is that okay?
Thanks. I'm a bit unsure about where the best place is to give an injection.
That's okay. It can be confusing. Before you give an IM injection, it's important to think about the best place for absorption of the injected medication and also patient safety during the injecting process.
Oh, I didn't know it mattered where an IM injection was given.
There are several areas of the body where IM injections can be given. Thinking about IM injections for adults first, you'll inject into the deltoid muscle for small volumes of medication. This is the most common site for vaccinations, like the flu vaccine for example.
Where's the deltoid muscle?
The deltoid muscle is in the upper arm. The best way to find it is to locate the acromion process, that's the bone at the end of the shoulder joint. Then measure down 2 to 3 finger widths from the acromion process. The deltoid injection site is in the middle of this muscle area.
Right. I see.
If you're giving injections of larger volumes, there are 2 sites you can consider using. The first site is the ventrogluteal site. This is used for injections of larger volumes of medication. This is the site you should use to give oily or irritating IM injections.
Okay. Where's the ventrogluteal site found?
The ventrogluteal site is just below the iliac crest on the side of the hip. This area has large muscle coverage and targets the gluteus medius and gluteus minimus muscles. An advantage of using this site is that it doesn't contain any major blood vessels or nerves.
Okay. What about giving IM injections into the buttocks? Can I do that?
The site you're thinking of is the dorsogluteal site, which targets the gluteus maximus muscle in the buttocks. Using this site is no longer recommended for several reasons. There's a risk that injections into this site may not reach the muscle because of the thick layer of fatty tissue in this area. This means that absorption of the medication may be delayed. The area also contains a major nerve and blood vessel, that is the sciatic nerve and the gluteal artery.
So, injection into the buttocks could cause nerve damage?
That's right. That's why injecting into the ventrogluteal site is now best practice. The other injection site for injecting larger volumes is into the vastus lateralis or lateral thigh muscle. The lateral thigh is the outer part of the thigh. This site is also used for infants and small children.
Okay. So, the deltoid site is best for small volumes and the ventrogluteal and vastus lateralis sites are used for larger volumes.
That's correct.
So, how do I give the IM injection?
Bring your injection tray to the bedside with the prepared syringe and anything else you need to give the injection. Before you give the injection, check the patient's identity and also check the medication chart to make sure the prescription is correct.
Okay.
Next, you'll assess the appropriate injection site for any signs of cuts or abrasions, signs of infection or rashes. Also take note of any moles or tattoos, as you shouldn't inject into these areas.
Once I've selected the site and checked it, what's next?
Sanitize your hands and put on a pair of non-sterile gloves. If the skin you're going to inject into isn't clean, swab the area with an alcohol wipe and allow the area to dry for 30 seconds.
Okay.
Then, stretch the skin around the site with your non-dominant hand to make it taut. This makes it easier to insert the needle. It also reduces pain and minimizes potential leakage from the injection site.
Right. I get it.
Hold the syringe like a dart with your dominant hand and insert the needle at a 90-degree angle into the skin. Slowly depress the plunger, injecting at a rate of about 1 milliliter every 10 seconds. This helps reduce pain and allows the muscle to absorb the medication.
Do I need to pull back on the syringe before I inject, to check for blood aspiration?
This used to be the procedure for all IM injections, however, Best practice is that this is no longer necessary for injections into the deltoid or thigh muscles. Although it's no longer recommended, the dorsogluteal site is still used by some practitioners. In this case, it's still important to check for blood before injecting into the buttock. This is because the gluteal artery is close to the gluteus maximus muscles, so there is a risk of injecting into the artery rather than the muscle.
Right, I see. After injecting the medication, what's next?
Wait 10 seconds to allow the medication to settle in the muscle tissue. Then quickly withdraw the needle. Apply gentle pressure onto the site if there's any bleeding, and place a small plaster over the puncture site.
And then I discard the needle and syringe into the sharps container.
Yes. That's right. Don't resheath the needle or you may risk a needle stick injury. And don't forget to sanitize your hands after the procedure.
Okay, thanks for the explanation. I'll practice on a mannequin now before my first injection on a real patient.